You live in a city, then you're not facing one threat. You're facing five. And they're amplifying each other in ways scientists are just beginning to understand. Air pollution damages your cardiovascular system. Water contamination causes infections. Missing green spaces worsen mental health. Uncollected waste breeds disease. Urban heat kills during heat waves. Separately, each is dangerous. Together, they create a perfect storm. This is Global Health Decoded, where we examine the science behind global health crisis. I'm Dr. Anthony Iyore and Anaweokhai. Quick reminder, this is educational content based on peer-reviewed research. This is not personal medical advice. For health concerns, consult qualified healthcare professionals. The interconnection framework. Over 6 episodes, we've examined 5 major urban environmental health threats individually. Today, we are examining how they interact, amplify each other, and create cumulative disease burdens that exceed the sum of individual effects. Public health research increasingly recognizes that environmental determinants don't operate in isolation. They form interconnected systems with synergistic effects, where the combined impact exceeds what you predict from adding individual effects. Think of it this way. If air pollution increases cardiovascular risk by X% and heat stress increases it by Y%, you might expect combined risk of X plus Y%. But research shows the actual combined risk often exceeds that, sometimes dramatically. The stressors interact physiologically, creating amplified harm. As usual, we begin with a quote. Complexity isn't chaos, it's interconnection. And once we see the pattern connecting separate threats, we can design interventions that address multiple problems simultaneously. The framework for understanding this starts with recognizing that vulnerable populations face multiple exposures simultaneously. A person living in an informal settlement doesn't choose between clean water or green space or waste collection. They lack all three. Plus, they breathe polluted air and experience heat island effects. Now, these aren't separate problems requiring separate solutions. No, they are interconnected manifestations of inadequate urban infrastructure driven by rapid urbanization, constrained resources, and structural inequities that determine who gets environmental protection and who doesn't. Let me show you specific mechanisms of how these threats multiply each other. Example 1, air pollution plus urban heat. Now, both air pollution and heat stress independently damage the cardiovascular system. PM 2.5 exposure triggers inflammation and increases thrombosis risk. Heat stress increases cardiac workload, blood viscosity, and dehydration. During heat waves in cities with high pollution, cardiovascular mortality spikes beyond what either stressor alone could predict. The physiological pathways interact. Inflammation from air pollution impairs thermoregulation. Dehydration from heat concentrates pollutants in airways. Cardiovascular systems already stressed by chronic pollution exposure cannot handle additional heat load. Research from cities experiencing simultaneous heat waves and high pollution days show cardiovascular emergency departments visits increase 40 to 60%, far more than the additive effect of each stressor separately. Lack of green space plus poor waste management. Now, absence of green spaces removes multiple protective factors, physical activity opportunities, mental health benefits, social cohesion, and heat mitigation. Poor waste management creates vector breeding grounds, pathogen reservoirs, and respiratory irritants from burning. In neighborhoods lacking both, residents experience compounded effects, limited physical activity due to unpleasant outdoor environments where waste accumulates, increased anxiety and depression from deteriorated surroundings, elevated exposure to vector-borne diseases, respiratory infections from waste burning, and heat stress from lack of shade. I'll give you another example. Water contamination plus malnutrition from repeated infections. Now, contaminated water causes diarrheal disease. Diarrhea now impairs nutrient absorption, causes weight loss, and in children, it stunts growth and cognitive development. Now, malnourished individuals have weakened immune system, making them more susceptible to subsequent infections, including waterborne disease, thus creating a vicious cycle. Children growing up with repeated diarrheal infections develop environmental enteropathy, by which we mean chronic intestinal inflammation that permanently impairs nutrient absorption. This isn't just cumulative, it's multiplicative. Each infection makes recovery from the next harder. All five threats combined is our fourth example. Now imagine this: a child grown up in an informal settlement without piped water, surrounded by uncollected waste and with no parks, breathing polluted air from nearby traffic and industry during increasingly frequent heat waves. Now that child faces chronic respiratory infections from air pollution, repeated diarrhea diseases from contaminated water, vector-borne diseases from waste accumulation, limited cognitive and physical development from lack of play spaces, and heat-related illnesses during summer. Each threat compounds recovery from others. Malnutrition from diarrhea worsens respiratory infections. Each stress during infectious illnesses increases mortality risk. Now, this isn't hypothetical. This describes the daily reality of over 1 billion people living in informal urban settlements globally. Now, let's examine the cumulative burden in measurable terms. Quantifying the perfect storm. Now, when we examine disease burden data for cities with multiple environmental hazards simultaneously, the patterns are stark. Number one, air pollution. We established that air pollution causes 8.1 million deaths globally when combining outdoor and indoor sources. It is the second leading risk factor for death worldwide. Water and sanitation. Inadequate water and sanitation and hygiene contributes to approximately 1.2 million deaths annually, with diarrheal disease being the second leading cause of death in children under 5. Third, lack of green spaces. Now, while harder to quantify direct mortality, research shows measurable impacts on mental health service utilization, cardiovascular disease rates, and heat-related mortality. In fact, studies estimate that lack of urban green spaces contributes to thousands of premature deaths annually in major cities. Waste management. Inadequate waste management and collection increases conditions for vector-borne disease transmission, for waterborne pathogen spread, and for respiratory illness from burning, thus contributing to hundreds of thousands of infections and deaths annually in cities where collection rates fall below 50%. That brings us to urban heat islands. Now, during heat wave, the urban heat island effect is responsible for more than 50% of heat-related mortality in some cities. As climate change intensifies, heat waves, this burden is growing rapidly. But here is the critical insight. When you add these burdens together, you don't get a single sum. You get amplification. The WHO estimates that environmental risk factors collectively account for approximately 24% of the global disease burden. In urban areas with multiple simultaneous exposures, that percentage increases substantially. Multi-morbidity patterns. Now, research increasingly documents multi-morbidity. What do we mean? Multiple chronic conditions in the same individual, driven by environmental exposures. A person exposed to air pollution doesn't develop just cardiovascular disease, no. They develop cardiovascular disease and respiratory disease and potentially metabolic disorders, all with shared inflammatory pathways triggered by pollution exposure. Add malnutrition from repeated waterborne infections. Add mental health impacts from lack of green space, and add heat stress from urban heat islands. And then you see individuals with 3, 4, 5 chronic conditions simultaneously, all traceable to environmental determinants. I'll give you a quote. Education transmits knowledge, skills, and values from one generation to the next to ensure both individual and societal flourishing. Now, but these urban patterns threaten to transmit harm instead. Children growing up with multiple environmental exposures develop chronic disease earlier, have shorter life expectancies, and have less capacity to flourish. We must break that cycle. Healthcare systems face overwhelming demand in cities with multiple environmental stresses. Emergency departments fill during heat waves with dehydrated elderly patients who also have chronic respiratory disease from air pollution and cardiovascular disease from multiple risk factors. Children arrive with diarrheal disease compounded by malnutrition from previous episodes. The system treats symptoms, while environmental causes remain unaddressed. I'll give you another quote. The problems we face aren't random. They are the result of thousands of small decisions about infrastructure, about investment, and about priorities, which means thousands of different decisions could solve them. The economic burden is staggering, mind you, but healthcare costs for treating environmental-driven diseases, lost productivity from illness, premature mortality, and reduced educational attainment create a massive economic drag on cities already struggling with limited resources. And this burden isn't distributed equally. Throughout this series, we've noted that each threat disproportionately affects vulnerable populations, informal settlements, low-income neighborhoods, racial and ethnic minorities, recent migrants, marginalized communities. Now, when multiple threats compound, the inequity magnifies exponentially. One, geographic concentration. Satellite data, public health mapping, and demographic analysis consistently show that environmental health cluster in the same neighborhoods. Areas with poor air quality are also areas with inadequate water access, with missing green spaces, with uncollected waste, and with intense urban heat islands. Now, this isn't coincidental. It reflects historical patterns of urban development, zoning decisions that located industry and highways in certain neighborhoods, underinvestment in infrastructure for marginalized communities, and ongoing political power imbalances that prevent effective advocacy for environmental improvement. Next, we look at socioeconomic stratification. Now, within cities, environmental quality stratifies clearly by income and race. See this. Wealthier neighborhoods have better air quality because they are located away from traffic and industry. They have reliable water and sanitation services. They have abundant green space. They have regular waste collection and more tree canopy that mitigates heat islands. On the other hand, poor neighborhoods have the inverse. Worse air quality, intermittent or absent water services, minimal green space, inadequate waste collection, and severe heat island effects. What's the result? Is a measurable life expectancy gradient across neighborhoods in the same city. In many US cities, life expectancy differences of 10 to 20 years exist between the wealthiest and the poorest zip codes. This gap has been largely attributable to environmental determinants and their health consequences. Next, we look at vulnerability for children. Now, children face, sadly, disproportionate impacts from environmental hazards. Their developing bodies are more susceptible to air pollution, to lead exposure, to malnutrition from waterborne disease, and heat stress. Thus, environmental exposure during critical developmental windows create lifelong health consequences. Children growing up with multiple environmental stressors show lower birth weights, higher rates of asthma and respiratory disease, developmental delays, reduced educational attainment, and earlier onset of chronic disease in adolescence and young adulthood. Next, we move to the elderly. Elderly populations face compounded risk from physiological vulnerability. What do we mean? Reduced thermoregulation, compromised immune systems, chronic diseases. And also, they often live in older housing with worse environmental conditions. During heat waves or pollution episodes, mortality concentrates in elderly populations in the most exposed neighborhoods. Quote this. Thriving isn't a solo achievement. No, it's never been. It's woven into the fabrics of our communities. When some can't thrive due to environmental hazard, none of us fully flourish. Health is collective. The data is unambiguous. Environmental health threats create and perpetuate inequality. Where you are born, where you grow up, where you live determine your environmental exposure, which in turn determine our disease risk, which in turn determines your life expectancy. But here's where we pivot from crisis documentation to solution recognition. 7 episodes documenting crisis. Now we want to shift to 5 episodes going forward that will examine the solutions. But before we move forward, let me establish the framework for how solutions work when threats are interconnected. Number one, integrated interventions. Now, because threats interact and amplify each other, solutions that address multiple threats simultaneously are more effective than isolated interventions. For example, creating urban parks simultaneously addresses lack of green space directly, urban heat islands by trees providing cooling, air quality by vegetation filters pollutants, and mental health by access to nature, and physical activity, space for movement. One infrastructure investment addresses 5 problems. Improving public transportation, for instance, also will reduce air pollution because there are fewer vehicles. We reduce traffic-related injuries. We reduce physical inactivity because you are walking to and from transit, and can even reduce urban heat islands if combined with green infrastructure along these transit corridors. Thus, investing in water and sanitation infrastructure will go ahead to prevent waterborne disease directly, malnutrition because of reduced diarrhea diseases, and often improve waste management through integrated planning. Equity-centered design is another solution we must provide. And these must prioritize areas with the highest burdens, which are typically areas with the least political power. Environmental justice requires explicit focus on reducing disparities, not just improving average outcomes. This means targeting infrastructure investment in underserved neighborhoods, ensuring participatory planning that includes marginalized community voices, disaggregating data to track outcomes by race and income, and designing policies that explicitly aim to reduce environmental health gaps. Systems thinking. Now, by addressing interconnected threats requires system-level interventions. Urban planning that integrates health considerations, cross-sector collaboration between health, transportation, housing, environmental agencies, governance reforms that create accountability for environmental health outcomes, and sustained investment in infrastructure maintenance and upgrades. Finally, community leadership. This is the most effective solutions emerge when communities experience environmental burdens, lead intervention design themselves. Top-down technical fixes often fail because they don't address actual local conditions, actual local priorities, or actual local constraints. Community-led solutions show higher sustainability and better outcomes. Now, over the next 5 episodes, we'll examine specific evidence-based interventions with documented health improvements. We'll look at urban planning strategies that save lives, community empowerment and health system strengthening, frameworks for building megacity resilience, proven interventions with hard outcome data, and the future of urban health with smart cities and climate integration. But the fundamental message is this. A perfect storm of urban environmental threat, it's not inevitable. It's the result of decisions about infrastructure investment, about urban design, about policy priorities, and about resource allocation. Different decisions create different outcomes. We know what works. We have evidence. We have examples of cities that have succeeded. The barrier is not knowledge, it's political will and prioritization. Drop a comment. Which of the 5 environmental threats concerns you most where you live? Or are you experiencing multiple threats simultaneously? Three key takeaways from today. Number one, urban environmental health threats don't operate in isolation. They interact, they amplify each other, and they create cumulative disease burdens greater than the sum of individual effects. Air pollution plus heat stress creates cardiovascular crisis. Water contamination plus malnutrition creates cycles of disease and developmental harm. Second takeaway, these interconnected threats concentrate in the same neighborhoods. We're talking informal settlements, we're talking low income areas, we're talking communities of color, first creating zones of extreme vulnerability where people face five simultaneous environmental hazards. The resulting health disparities are measurable in life expectancy differences of 10 to 20 years within the same city. Third key takeaway. Now, because the threats are interconnected, solutions that address multiple problems simultaneously are the most effective. Urban parks will reduce heat, will improve air quality, will promote physical activity, will enhance mental health with one infrastructure investment. Integrated, equity-centered, systems-level interventions offer the same path forward. 7 episodes showing you the crisis. Now, 5 episodes showing you the solutions. Next time, we'll look at urban planning strategies that are already saving lives with evidence to prove it. Our episode 8 will be titled Evidence-Based Solutions, Part 1, Urban Planning that Saves Lives. If this research challenges how you think about cities, hit subscribe. We're releasing new episodes weekly. And the next time, we'll be looking at evidence-based solutions part 1, urban planning that saves lives. I'm Dr. Anthony Iyore and Anaweokhai. And remember, real health starts with real